When you're given a rare disease diagnosis, your whole life suddenly is on a different trajectory. Nothing will ever be the same.
My name is Zachary Thomas. We live in Alabama, and I have a rare disease called Hurler syndrome, and we come up here for treatment.
So Hurler syndrome is a rare inherited disease. Essentially, it's an enzyme deficiency. Patients are born with this disorder. Untreated, it's progressive. Rare diseases are defined as disorders for which there's less than 200,000 patients within the United States. So certainly Hurler is a rare disease, if not ultra-rare disease. But the University of Minnesota has been very interested in rare disorders, and the vast majority of the kids that come here, they come here for the reputation and because we have experience in the disease.
Our diagnosing geneticist is from the Midwest. There were a couple of centers that were really kind of hubs for the disease, and he said, if this was my child, I would take him to Minnesota.
Part of the reason that people come back is that we have assembled a team here. Virtually all the subspecialty groups that these patients need are present here, and there are people dedicated to the patients and will do their best to take care of them.
Essentially, what's relevant for the disease has been created or co-created at this institution. That it's possible to correct a genetic disease by bone marrow transplant. This was absolutely a phenomenal discovery at this university.
Essentially, we're taking blood cells from someone else that have the ability to make enzyme and engrafting them into a patient that doesn't have the enzyme. And so those cells from someone else who can make the enzyme circulate through the body and provide enzyme throughout the life of the patient. And the University of Minnesota was instrumental in trying those types of therapies for these types of disorders.
We've encountered doctors now in 4 different states, and we see, I think, 14 specialists, and Dr. Orchard's he's the most calming, he's the most reassuring. That's just a totally different level of trust, because when you come in for a transplant, they give you the mortality rate, and that's a real thing that you have to face. But having someone as kind and compassionate as Dr. Orchard makes it a little easier. You have to be the advocate for your child, and that, again, is another reason why we come to the U, because it does take a little bit of the pressure off of me, knowing that the doctors or nurses or anyone have even heard about our disease. If we went to a regional hospital back home, your doctor may remember a paragraph from medical school, but chances are, none of the other staff would have remembered. So it gives us a level of comfort and takes some of the pressure off of being a medical advocate.
To have the courage on behalf of your patients to change the status quo has been defining for this medical school. You can open yourselves to these surprising blessings that can come from that courage to take that step.
It just warms your heart just to know that there's people out there that care so much about strangers, and we would never have experienced that if it wasn't for our diagnosis. We would never have experienced so much love and support.
Since you've been through this, if you had a message that you wanted to tell somebody young like you before they go through this whole process, what would your message be to them? What would you want to say to them?
If you believe, then you'll be fine.
I think our society as a whole is so focused on perfection and things the way that we think it should be, and we are so self-important and self-involved that finally, through a lot of prayer and a lot of community with other rare disease moms, it finally just got to me where, I'm here for a greater purpose. I may not know what all that is, but my purpose is, my vocation in life is to be their mom. We may not be everything, we may not be the fastest, we may not be the first to finish, but we can always be the kindest.